Mayor has to say that. Tell back to the minute.
Hi, everyone. I'm sorry we're a little late. I'm sorry that took a couple minutes there. We have a new procedure now. We have to let people into the room on these Zoom calls the way they've been set up. Sorry we just got finished a few minutes late. So thank you for bearing with me here. So we'll start with the numbers. Sunday we had plus 66, Monday plus 111, which is a little disconcerting. And then for Tuesday we had plus 89 for a confirmed total of 4,254 cases in the county here. And as you look at the numbers, what to me is a little troubling is the jump in the younger groups here. You see that the 20 to 29-year-old group starting to surge. And I think a lot of that has to do potentially with people getting back out there, getting to work, socializing and doing those type of things. And it's something that we really have to emphasize and moving forward. That there's still a danger there. We've got a long ways to go, and we're going to ask everybody to adhere to social distancing and facial coverings. And I'll tell you why, because so much is at stake of staying off that state watch list, which is so important at this point in time. The death tolls at 114, like we mentioned. The interesting thing is, and the good thing is that we've seen somewhat, to some extent here, the deaths in the residential care facilities stabilize. We haven't seen those jumping up as much as we have in the past. In fact, I think we've stayed at 78 for maybe a week now or so, which is great. Any death is tragic, but this was an area that we were particularly concerned with, and we did a great deal of work in trying to stabilize this, even though these are state-run or state-regulated facilities. We stepped in with our healthcare providers and healthcare services, and to help educate and provide PPE and all those things. We believe that is starting to pay off now, in that these facilities now feel more comfortable with the right PPE, with the right training, with the right isolation type of mechanisms that they can put in place that we hopefully have stemmed those for this period of time, and hopefully that'll be the case into the future. So we're going to continue to monitor that, and we'll keep you updated on that. You can see as we've gone to the new format here, to give you a better look at the visuals here, we have 62 hospitalized now with COVID-19 throughout the county. You can see the confirmed and suspects. We're drilling down and giving you more information, and then you'll see the breakdown of the acute care beds and ICU beds and surge beds, and confirmed cases in the daily occupancy of ICU and COVID-related beds are broken down per day now. So you can see what is COVID-related, what is just typical ICU type of related cases, and then the availability. The other features that we've included is the out-of-county confirmed. So of the 62, we've got 23 of those out-of-county. That's 40% of those, and it's so important that they not be counted against us when we're looking at the metrics that decide whether to put us on the watch list or not by the state. So health has done a good job advocating for us, and there is an understanding now that they will not count against us, which is so important. On to the next one. I want to call your attention to one area of somewhat of a concern for us, and that's the positivity ratio, which again is a driving metric on the watch list for many cities, for many counties, excuse me. Right now we're at 5.0 where you want to be. You want to be 5.0 or below, given where we're at. But as we'll talk about in the minute here, there is a state effort to reduce the amount of testing that is taking place for a variety of reasons, namely the backlog of the testing capabilities of returning those tests in a timely manner. which then trigger a whole host of other things like contact tracing. The sooner you get those test results, the sooner you can get to those people who hopefully were in contact with this person, and then try to warn them or try to get them isolated. In the longer period, of course, that goes by extends that ability to do that. But as tests go down, and you're going to hear that the state is limited fairly to 500 tests a day. In some cases, we're doing 1,000 a day, or in between 700 and 1,000 a day. As those go down, the positivity rate could go up as you have less people to be tested, and presumably the same amount of people turning positive. That could go up. So we're hoping that the state will take that into consideration and adjust that accordingly also. And it's something that we've got to keep our eye on, and we've got to make sure that they adhere to those rules that make sense, and not arbitrary ones that as the rules of the game change here. As you can see, we've almost hit 85,000 people tested in the county, and we talked about the average daily rate of 2 days, 2.12 days as far as a return. So with that, I'll go on to some of the updates that we hope to see. We've already seen some of these on health, and health has been working night and day to try to get out as much information as possible that is useful to all of you and the public. So they've completed the first priority ask on the webpage, which was to improve the hospital dashboard that depicts the transfers from other counties. So we're seeing that. So it's not only San Quentin, but maybe other impacted counties we have patients being sent here because we have the surge space, we have the ICU beds, and we can take care of them. And the next phase is something I think is very important too, and that is they're working on an effort to display information that shows how we are doing relative to the state and Bay Area health metrics. And this is I think this will be very informative because it will act as a visual on those key metrics so that people can see if we're moving out of the green into a yellow or into an orange or potentially into that red, which could result in the state putting us on the watch list. Because as Dr. Morrow has said many times, it is now up to the public in this county. You see the counties around us all being on that watch list, from everywhere in the from Marin, Solano, Contra Costa, Alameda, I think will be put on tomorrow. Santa Clara will be put on tomorrow. San Francisco is not, but they have not opened to the extent that we have. So we are the only county in the Bay Area, really, that is open to the extent that we are an opt-out list. And we want to maintain that. And we want to make sure that we stay off that list. And it's going to depend on the people here in this county and some of the campaign information that we get out there and inform people that we really are early on in this. And I would say maybe instead of the second inning, maybe we're in the third inning of a 9-inning game, and we could go to extra innings depending on what happens. So we've got to stay vigilant. We've got to make sure that people know what's at stake here if we don't. And we'll talk about that in a minute. So going back to the numbers at ACS Burlingame, we look to, they've got 12 guests there, and we'll look to transition on that site soon as we've had that site up and running almost since the very beginning. And we'll look for other options to continue to provide the services, but in a different manner. The Bayfront Station, we've got 91 guests with 81 rooms. I think we have a couple of rooms available there. And the homeless in various hotels is 90. So 181 individuals are being housed right now in hotel rooms. So what was new and different, and I mentioned some of that, is this tier system that is in regard to testing that the California Department of Health has come out with. And tier 1 will be the priority, hospitalized with COVID symptoms, investigation and management of outbreaks, and close contacts or confirmed cases. They will be in tier 1. And tier 2 priority, all others with COVID symptoms. So asymptomatic and higher risk that live or work in congregate care facilities, shelters for people experiencing homelessness, work in a health care sector, provide care to elderly person, work in emergency services sector, work in correctional facilities, patients requiring preoperative or pre-hospital admission screening, and patient being discharged from hospital to lower levels of care. So that will be tier 2. Tier 3 They work in retail, manufacturing, food service, work in agriculture or food manufacturing sector, work in public transportation sector, or work in the education sector. And tier 4 priority would be only implemented when the state's testing turnaround time is less than 48 hours. And that would apply to other individuals not specified above, including those who are asymptomatic, believe that they have a risk for being actively infected. So this will change. The whole algorithms of testing for virally, of how you sign up for a test, will change as we now transition out of this wholesale testing to a more specific data-driven set of individuals who are in need of testing. So people can certainly still go to those healthcare providers, their own healthcare providers, and get tested whenever they want, presumably within that healthcare plan. But as far as the free testing, we will be meeting with Verily this week to determine, but it's not going to be a situation where someone's asymptomatic. You can call up and just get tested, presumably in the future. We will work out what those algorithms look like in the upcoming week and hopefully have that by next week. But that testing will change in the near future, and already has changed as far as the capacity of the amount that they can test down to 500. So we will be switching that philosophy of testing and getting people to go to their primary care physician instead, who have insurance. And we'll certainly happy to send out that the email with the tiered approach, but I'm sure that many of you have access to that already. So the testing numbers, so we've got 3,689 tested last week. We had, of last week, 1,100 walk-ups, so that seems to be working well. Again, all this will change in the near future. The average no-show rate was 7%, and this week, because of the new testing procedures have only limited to 500, they'll be closing at 3 o'clock. So Monday we were in San Mateo, Tuesday in Daly City, Wednesday today in Daly City, and Thursday and Friday in East Palo Alto. So in addition, and this is why it's so important, statewide, as you all know, the state has shut down indoor dining in restaurants, winery and tasting rooms, movie theaters, family entertainment centers, zoos, card rooms, brew pubs, breweries, bars, and pubs, indoor and out. If we moved to that watch list, additionally, the fitness centers, worship services, protest, office for non-essential sectors, personal care services like nail salons, body wax, and tattoo parlors, hair salons, and barbershops, and malls will be closed. And as I mentioned before, the county's already on the watch list: Contra Costa, Marin, Napa, Solano, and Sonoma, and we believe Alameda and Santa Clara tomorrow. SF and SMC are the only ones left in the Bay Area not on that list, but we are the only county that is fully open. San Francisco is not open to the extent that we have. So we want to ensure that we remain open, and to do that, we're going to have to take the precautions. The Great Plates program continues to be such an incredible success. It's been extended to August 9th. We may look to extend it to at least the end of August, and then we're looking at what will happen after that, because if it's not extended by the state. Almost 1,700 folks are participating in that right now, 1,690 to be precise, and we've been able to pump about $4 million back into the economy, into local restaurants through the Great Plates program, because it's really been a great win-win. Okay, so on to the immediate questions. Number one, appears Redwood City numbers are catching up to San Mateo, and theories on that. We're doing more testing down in the North Fair Oaks area, which is capturing probably more of Redwood City. Certainly, we're worried about the Hispanic Latino numbers that are increasing, and we're looking into that. Sarija, I don't know if you have more information on that, about the specific numbers in Redwood City.
We continue to caution against drawing major conclusions from the geographic data just because of the testing constraints. But from our case and contact investigation, small gatherings, family social gatherings, are a contributor to the increase in cases. And we see more of those in the southern part of the county which could include Redwood City. So, just need to keep reinforcing these key messages about social distancing, facial coverings, avoiding gatherings, outdoor is safer than indoor. It sounds monotonous, but it's really important.
Right. And the next one is how acute is the testing shortage, and is there anything that can be done to increase it? Look, the state has been the one to come down with the mandate of 500 through Verily. This is a free testing. Everyone that has insurance can still go to their primary care physician and get tested. Certainly they can go to the clinics if they need testing and get tested. It's just a different priority now. And we're moving away from that asymptomatic, holistic testing of everyone to a more specific testing that will give us some data that will really maybe help us really curb it in the future. So that is, I think, where the trend will go in the future. But the real problem, not only with the test kits, is really the testing turnaround, because as I mentioned before, that is so critical to the contact tracing. Wouldn't it be great if we got the testing turnaround to 24 hours or even better, 2 hours? So I think that's where the real benefit may come in the future, and that's why we're focusing on that. The next question is, numbers still high in the Latino population. We did talk about that. It looks like there's 2 deaths each in the 30 to 39 and 40 to 49 age bracket. When do they take place? I have no idea. Sarij, I don't know if you know.
I looked those up. So the death of the 30 to 39-year-old was registered on the week of April 30th, and of the 40 to 49-year-old, the week of June 11th.
Great. Local hospitalizations seem low and steady. Any early indications that could swing up? I mean, it's entirely based on behavior. I mean, obviously they're swinging up because we're getting out of county folks with COVID-19 that we're taking care of. And we're trying to break that out for you so you have an idea. But 40% of those are from out of county. It's really going to depend on the folks here and what we do, and we'll wait and see. But I think that that visual will help people that we're talking about putting out there, so they'll get the understanding there are consequences to these actions. That we could thread the needle and continue to remain open and off the watch list if we do what we're supposed to do, and that's what we're aiming for. And the last question: San Mateo County has avoided being on the state's new list for additional closures. Are there risks of us being added? Absolutely, absolutely. There's a risk for us being added, and how do we avoid it? We just talked about that. We got to make sure that it's really up to us. Part of that will be the campaign that we're going to come out with here. And just every visual opportunity we get, every reminder we get that our fate is in our own hands, and we're going to have to really make sure that we follow these rules for an extended period of time. There is no quick fix here. I'd like to said before, maybe we're in the 3rd inning now of a 9-inning game, but we've got a long ways to go, and we can't let our guard down now. And like we talked about before, COVID-19 doesn't take a holiday. It doesn't take a summer off. It doesn't go away for a party or for anything else. It is there, and we've got to make sure that we understand that and try to remain open and off the watch list. So with that, why don't we go ahead and take some questions?
Henrietta J. Burrows.
Just a little confused, forgive me. You talked about the statewide shutdowns and all of the businesses that will have to close. And you said that San Mateo County is still fully open. So does that mean the businesses that were listed as having to close statewide can stay open in San Mateo County?
No, and Henry, I'm sorry for the confusion. What I was saying was that we fully opened to the extent that we followed that we were fully open to the state, what the state standard was. Now we've had to cut back, just like everyone else, on indoor dining and wineries and tasting rooms and movie theaters and family entertainment and zoos and museums and car rooms and brew pubs and bars and all those things that were open before, to the extent they were open. But what we're not closing down additionally, in addition to that, because we're not on the watch list, fitness centers can remain open, houses of worship can remain open. To the extent that we have protests, they can still continue. The offices for non-essential sectors can stay open. Personal care services like nail salons and body waxing and tattoos and hair salons and barbershops and malls can remain open in this county because we're not on that watch list. But those other things that apply to the entire state, absolutely, we must adhere to also. It's these additional things that we'd be subject to if we're on that watch list, and that's why it's so important to stay off that watch list. That's a big sector of our community here. Lots of things that people like to do, and we want to thread that needle and make sure that we still do them, but we do them safely.
Thank you.
Sierra Lopez.
Sarah, are you there?
Thank you. Yeah, I'm right here. Thank you. Previously, it's been mentioned fairly regularly that our care facilities are of concern. I do understand that cases within the facilities have kind of plateaued a little bit, but we are seeing rising cases out in the general public. The new order announced today allows visitation into these facilities. Can we just talk a little bit about the reasoning behind allowing the visitations now and what kind of preparations are being taken to ensure that those go safely and that we're prepared for any spikes?
Yeah, let me start, and then I'll turn it over to Sarita and maybe even David, who's on the line, to talk about the new order. But I think that there's a balance in everything we do and we've tried to do, and the social isolation of these folks is detrimental to their mental health. I mean, going without seeing family members for extended period of time is not good for anyone. And we've taken now a period of time, and I got to give health such credit for going into these establishments. I can't emphasize enough that it's not our obligation to do that. These are state regulated, but they're in our county. These are our people. We went in with extensive health resources to stabilize, to train, to make sure they had PPE, and they were all required now to have procedures in place and had to report those back to the state. That time has allowed things, and those efforts have allowed things to stabilize to the point where, when folks show up to visit their loved ones, it's good for them. We need that. We need that stimulation. We need that connection to our family. But they will still have to take precautions in wearing masks, in keeping it socially distant, and making sure it's outdoors where there's less of a risk, unless it's absolutely necessary to be indoors. For all those reasons, I think that's why Dr. Moore has recognized that the benefit outweighs the risk with all these other factors in place. And Sarita and David, I'll turn it over to you and see if you have anything to add to that.
I would just add a couple things. Our facility partners have gained experience in what's required to keep residents and staff safe over the course of these last several weeks. And as they've strived to create that balance of safety and also connection with family that can be sustaining health-wise, we feel they're better prepared now as they've, adapted to everything that's been put on them. We also did look at what guidance had changed across the country, other states, to shape our guidance.
Great. David, anything to add?
I would only add that, and I don't want to read the whole order, but it puts a lot of conditions on visitation. So first, let's just talk about one set of visitation that's allowed is, and I have to, it's for people who are dying. And so, there's a rationale for that. That can happen indoors if it can't happen outdoors. But the primary expansion is of outdoor visitation, and it is heavily circumscribed. There are multiple preconditions involving, having sufficient PPE and staffing before folks can even do it. And then the way that the visits also are to occur is heavily circumscribed, like preventing people from walking through, areas where other people are, maintaining social distancing, monitoring. And these are outdoor visits. I don't want to suggest that there's no risk. I mean, all activity carries some risk, But the way that this order has been designed was to balance, that risk, with trying to meet the social, the social needs of these people who are, vulnerable and ill. So, I would urge that folks take a look at the order and you'll see what I'm talking about.
Great, thank you. Anything else, please?
Those are all of the raised hands. There was only one chat question asking if we could send out the link to the slides, but I believe we'll send out the email with even more information.
We will.
Other than that, no other questions.
Great, thank you all for being with us today. Stay safe out there and healthy. Enjoy this beautiful Wednesday tax day, the new tax day, and we will be back next Wednesday. Take care.